Our next speaker is Dr. Stauder from Austria, who will talk about consensus on a core outcome set for MDS. Welcome to you.
Dear Chairman, dear ladies and gentlemen, and thanks a lot for the chance to present this data. This work has been performed in the context of the MDS Right project of the EU MDS registry. This is a list of the co-authors and all of the participating centers. So very many centers from Europe and Israel have been participated. You have realized today, even in this session, we have the situation that evaluation of response in MDS is challenging. For example, we have mentioned the term of clinically meaningful response, or we have discussed about the inclusion of AML criteria to be applied in MDS. Based on this background, and considering that response criteria so far have been established by the IWG in 2000 and have been revised recently, and we have to realize that the main focus so far is on hematological improvement. Another relevant aspect is the alteration of the history of the disease, which means we are defining remission, progression, and survival. However, we have realized in the last years that other parameters, mainly the so-called patient-reported outcome measures, might be relevant. They are suggested by stakeholders, they are suggested by authorities. And the question was how to integrate this classical, to integrate the classical or traditional clinical outcomes with patient-reported outcome measures. Moreover, we tried to focus on the identification and standardization and harmonization, harmonization of outcome measurements from the clinical perspective of MDS experts. We tried to establish a standardized set of outcomes which should be measured and reported as a minimum and which should be included in future studies, so a kind of establishing a kind of basis. Core outcome sets so far have been defined for different types of cancer, and in hematological malignancies, core outcome sets have been established in myeloma and in non-Hodgkin lymphoma and in Hodgkin lymphoma. And our procedures are based on the guidelines of the so-called COMET initiative, which is a consortium which tries to standardize core outcome measures in clinical trials. We started with a comprehensive systematic literature review. In 425 clinical studies, we have identified 26 potential core outcomes, and then these core outcomes were classified by EU MDS experts in the so-called Delphi process. Delphi process means experts are asked to rank the outcomes, and in the second round, the results from the first round are presented and are discussed with the goal to improve knowledge and to maybe change the evaluation. So in the first part of the Delphi process and in the second part, very many colleagues from the EU MDS were asked to participate. In fact, the response rate was 24%, resulting in 56 responses. You see, responders were contributing from very many European countries, including Israel. These experts were mainly hematologists. I mean, you have to realize that in Europe and several countries, certification for hematology also includes certification in oncology too, which means the majority of responders came from hematologists and oncologists. The experts had a very long experience in their field, so which means the majority of them had more than 10 years of experience in treating MDS patients. Which were the results? This is a so-called spider diagram where the results of the Delphi process round 1 and round 2 are summarized. The specialists were asked to rate the outcomes in a so-called Likert scale evaluation, which means 1 to 3 is low importance, 4 to 6 is important but not critical, and 7 to 9 means that the outcome is critical for decision making. And this figure shows the percentage of highly important rankings. The first ranking is in red and the second ranking is in green. The dotted line is the 70% line, and the 70% line is per definition the cutoff to accept an outcome as relevant or as not. And you see that based on the 2 rounds, specialists ranked quality of life, treatment-related mortality, overall survival, performance status, safety, and hematological improvement as important outcomes in clinical studies. You see there are other outcomes like functional activities, remission, time to progression, and so on, which had rankings. However, the rankings did not fulfill the criteria to be established as a, let's call it a defined outcome. For me, it was a little bit surprising to see that, for example, cytogenetic response was ranked, but it did not reveal a very high ranking. In the 3rd round of the Delphi process, all of the results and all the outcomes were reviewed by 4 experts. Outcomes without consensus were excluded. I mean, in fact, no outcome was excluded at all. And 6 outcomes, the 6 outcomes which I just mentioned before, they were discussed and were retained. Once again, these are the 6 outcomes. The definition of the outcomes was given to the experts before the evaluation, so this is the definition of the outcomes. I mean, this definition just fulfills the criteria of general common sense on these definitions. Maybe performance status might be discussed. So if you only want to include WHO performance status, or if you really want to include instrumental activities. However, all other core outcomes are well-defined parameters from the literature. So in conclusion, we have performed a structured and comprehensive approach to give systematic evidence. So we have performed an international survey process within the MDS Right and EU MDS Consortium. So we somehow form the basis to start a discussion on the inclusion of this endpoint in clinical studies. Goal is to enhance the comparability across future clinical studies in MDS. Of course, the acceptance of MDS specialists throughout the whole world will be relevant, so we realize that, that this is so far an approach which has started in Europe and Israel. Inclusion of further relevant stakeholders might be a point for the future, which means continuous updating is recommended. This work has been performed in cooperation with colleagues and patients from participating institutions. It was supported by a Horizon 2020 grant. So thanks a lot to all colleagues and patients. Thanks for your attention. And the last slide is a promotional slide to highlight the launch of the MDS Europe websites, where interactive guidelines are presented. Please visit us at booth 3 at this conference. Thanks a lot.
Thank you. Do we have one question from the audience? Otherwise, because of the time, I think we will proceed